Welcome to our new online course that will be led by Dr. Pierre Bouhanna from France. Alice right now is going to present to you all the career of our speaker today. So Alice, please introduce our speaker now.
Dr. Pierre Bouhanna specializes exclusively in surgical dermatology focused on the scalp. He serves as a consultant at the Paris Saint-Louis Hospital, Sabro Center. He serves as a consultant and is the director of the University Hospital Pitié-Salpêtrière in Paris. Notable publications from Dr. Bouhanna include the phototrichogram, multifactorial classification, and FUL, unshaven long hair FUT technique. He has pioneered distinct transplantation methods for various hair types, with a focus on African and Asian origins, and is actively engaged in ongoing research involving stem cells, growth factors, and hair restoration for cancer patients. In 2015, he received the Platinum Award from the ISHRS, recognizing him as one of the world's leading hair transplant surgeons.
Hi, everybody. It's a pleasure for me to develop a technique that I have a long time handled and that I use every day in my clinic for conventional surgery. I have no conflict of interest. And concerning this procedure, I will first do an intro of the indication, for, in my opinion, for male and female pattern baldness, because more and more they become precise, and all the physician needs to do a choice between FUE, which means follicular unit extraction. And when we do this procedure, we do shaving, the FUT, which is a conventional hair transplant technique with strip segmentation, and we do a shaving before doing it. And at the last, the FUL, that means FUT with long hair, and we don't need to do any shaving. Before doing this choice, we have to do a careful clinical evaluation, to do a precise computerized analysis, to give to the patient a prognosis estimation, and to see about ethnic, age, and psychological considerations. At the beginning, we have on the left, as you see, punch graft. And punch graft was graft with 7, 10, and more than 10 hair by graft. And it's now 30 years that we developed the technique of follicular unit, and all the physicians in the States, in Australia, and developed this follicular unit procedure. Because the goal of this technique was to recreate the natural emergence of 1 to 3 hair per pilosebaceous orifice. First, to get the density of the on the bald area, and second, to ensure the refinements on the frontal hairline, and you see on the left, on the right. Well, the well-known follicular unit extraction procedure was done, and we extract with forceps, one by one, each follicular unit, and then to get this, we use a motor punch, and very gently we dissect and we harvest each follicular unit. The other procedure is the follicular unit transplant with segmentation. For that, you do a previous shaving of the donor area, but only on the location of the strip. And then you do with blade, multi-blade, or with one blade, strip harvesting and a dissection, a careful dissection of the strip. And then you do a closure with a running suture or with staples. Then with the segmentation is done under stereo microscope, and for that we can get one by one every follicular unit needed. Excuse me. So, and we have developed the follicular unit long hair. It was very interesting for us because we don't need to do any shaving, and you do exactly the strip harvesting as done for the FUT. And it's exactly the same for doing the